Oh, hello guys. This is Dr. Ariyo here again with another edition of Health Talk. Thank you so much. Thank you to everyone that has been tuning in. The feedback has been fantastic and very encouraging. Thank you. I'm just glad that obviously these sessions are having a positive impact on your health. That is what this is all about. So thank you for joining in. So today we are going to be talking about obesity, essentially being overweight, and why this is so important to take note of so that we can make changes in our health. This topic is quite a large topic to cover, so I have divided into a 3-part series so that we can gain as much as possible in each session that will be beneficial to you. So today we're just basically going to look at the sort of health risk associated with being overweight. Then we will talk briefly about how you can find out if you're overweight, because some of you might be wondering, should I be worried? Am I overweight? Am I not? What do I need to do? So we will learn about how to do that. And then we're also going to learn about the importance of setting goals so that we can achieve the desired results that we want. So welcome on this journey with me tonight. So why is obesity such a big deal, and why is it important to our health? Well, studies have shown that it's actually associated with the major leading causes of death in this country, not only in this country, but also actually worldwide. We know for a fact that obesity or being overweight can increase your risk of diabetes. Did you know that actually, if you are overweight, your chances of developing diabetes, type 2 diabetes, is actually 20 times more? Yes, that is serious. 20 times more. Your chances of developing type 2 diabetes is 20 times more. Now, why is this important to your health? We know that diabetes can cause serious health problems. Diabetes can affect your blood pressure. It can cause heart disease. It can cause stroke. We know diabetes for a fact is the second leading cause now of blindness. It used to be number 1. But because now we are putting a lot of effort in diagnosing diabetes and treating it earlier on, now is the second leading cause of blindness. It's also the leading cause of non-traumatic amputations. These are serious stuff. And you might actually know someone who has been diagnosed with diabetes before, or someone who has actually been affected by some of the problems that diabetes can cause. So being overweight is not really just about having a bit of fat on your body. It's actually a serious problem that can result in a lot of things that ultimately can result in death. So it is important to take note of it. The other thing that we know from studies is that actually diabetes can increase your risk of cancer. Yeah, the C word that everyone dreads. Being overweight can increase your risk of dying from cancer. And a lot of studies, one study that was done in America actually shows that actually they had a look at men and women of ages 50 and above, and actually for men your risk of dying from a cancer is actually about 20%. And that is really a big risk. And this is all to do with what? Being overweight, causing serious problems. The other thing that we know that obesity can cause, it can cause things like depression, because often people that are overweight, because being overweight, you know, can sometimes cause them to have low self-esteem. They feel low in themselves, likely to develop depression. Depression in itself can feed into it, and people can become overweight because of depression. Because when you're depressed, you're feeling low in mood, lack of motivation, you don't feel like doing anything, you don't feel like exercising, you just want to lie in bed, and ultimately you comfort eat the wrong things, and then you end up putting on more weight, which will then make you more depressed. So you get into this vicious cycle. So obesity, like we said, can cause and can affect diabetes. It can affect heart problems, strokes. It can affect cancer. and it can also have impact on your mood. So not only is it affecting your physical health, it's actually affecting your emotional and your psychological health. So it is really important, and the list can go on and on and on. You've probably seen people that are overweight. I mean, are they able to run a lot? No, it becomes difficult to move about. Often people are complaining of joint pains. It makes arthritis worse, increases your risk of joint problems. So there's so many problems that can come about simply by being overweight. Now, I have not said all these things to scare you, and I just wanted you to know the reality. This is reality. That something as simple as being overweight can lead to all these serious problems that can cause people to lose their health and their life. So if you are scared, well, I hope it's a good thing. So hopefully it will make you to sit up and do something about it. Because the good news is that being overweight is not a terminal illness. It's not a death sentence. You can actually do something about it. You can make changes, and it's never too late to make a change. Because perhaps some of you are saying, yeah, but you know, I even have diabetes, or I've been told that I've got high blood pressure, so I've got problems already, so it's too late for me. It's never too late. The evidence suggests that actually every little helps. So whatever changes you can make now can make significant changes. It can reduce your risk of having further problems. We know that even if you lose drastic weight, especially for people that have diabetes, we've seen cases where their diabetes have been reversed. They've come back to normal because they make such a big difference to their weight. And as part of the treatment now for people that are morbidly obese, we actually offer surgery, bariatric surgery, where they actually have surgery so that they can lose weight drastically to reverse their diabetes. So there's so much that can be done. So this is not for you to give up, but for you to be encouraged and take positive action. Now, if I was to ask you that, you know, would you wish upon someone to have a heart attack, to have a stroke, to have their limb amputated, or to have cancer? Would you wish it on someone? You would say no, definitely not. And I would say to you, are you sure? Because sometimes some of us, the actions that we take on a daily basis regarding either our diet, our physical activity, it shows that, you know, we wish that on ourselves, consciously or subconsciously, by the decisions we make on a daily basis. And that is why it is important to take note tonight that you can actually make a difference, and you can start by doing that now. Now, some of you might be thinking, I'm not too sure whether actually I am overweight. I can't remember the last time I checked my weight. So, well, the way that normally we find out whether you're overweight or not is quite simple. We use what we call the body mass index, BMI, yeah? And basically that looks at your weight and it looks at your height. And based on your age, it calculates and makes an estimation of your body fat. And that can give us a guidance if you are either underweight, or you are a healthy weight, or you are overweight. Now, let me just add here quickly that actually being underweight is not a good thing, because being underweight comes with a lot of problems. Often people that have eating disorders, you've heard of anorexia nervosa, for example, such people, they go through a lot of nutritional deficiencies. They have a lot of psychological problems, anxiety disorders. Some of them get very dehydrated. They end up in hospital. They go through a lot. So it's not something to be happy about if you are underweight. Actually, if you are underweight, you need to be asking yourself, am I overdoing things in terms of what I'm eating? Am I overdoing things in terms of physical activity? Do I need to tone things down a bit so that I can get to a healthy weight? Then how do I maintain that weight? If you are a healthy weight, you need to be asking yourself, how do I keep that? What am I doing right? Can I tweak it a bit? How can I get it better so that I can carry on doing that? And definitely, if you are overweight, like I've said to you, some of the problems that we can encounter in our health if we are overweight, you probably need to do a bit more work to lose the weight, to get to a healthy weight, and then work to maintain it. What we need to be thinking about is the long term. Your health is a long-term thing. It's not a short-term plan, because what you do now is something that should be something that you can do continuously on a regular basis to make sure that you are staying on top of your health. So I'm not asking you to go and set yourself any unrealistic goals in terms of, go and do a yo-yo diet where you restrict your diet so much and you can only cope with it for about 4 weeks if you're lucky, and then you find out actually, I cannot carry on with it. It's not sustainable. And then you find that you have to then go back to square one, and then you end up more miserable actually, because you put on the weights again. So we want to lose weight, but we want to lose it in a sensible, in a safe manner that will benefit us in the long term, but also is sustainable because we can make it as our lifestyle and we can keep doing it over and over again without any stress. So that leads me to making your health goals. Now, most of us, we wait till 1st of January to make, some decisions about our life. That's when we make all the goals that we want to make. And I bet you, most of us, on our list, we want to make the dollars, we want to make the pounds, and we want to buy a house and we want to buy a car. But probably most of us, we don't put any plan about our health. But you realize that actually there's only you only have this body, and if you don't look after this body, all the things, you can have all the plans, but actually if you fall sick or if you die, then what's the point of the car? What's the point of the house? What's the point of everything else? So our health is important. So I'm going to give you a task. You need to go and find out what your body mass index is. You need to know where you are before you can move forward. You need to know, am I underweight? Am I a healthy weight? Am I overweight? Because then that will decide your next step. So like I said to you, you don't need a lot of information. You just need your weight and you need your height. And actually you can either get that done at home yourself if you have a scale at home. Probably know your height already. You can go to your GP practice, see a nurse who will actually work it out for you easily. If you got those two numbers, you can also do it at home. Just Google it, body mass index. It will give you just put the numbers in. It will ask for your age and it will work it out for you. And so you know where you are starting from. It will also work out your ideal body mass, because your ideal body weight is the optimum weight actually that you need to have, that is good for you, is unique to you, to your body. That's when your body's metabolism is at its best. That's when your body can function as its best. So maybe when you do your BMI, it might tell you, actually you are not really overweight, but you are not at your ideal weight. So this is what you need to do, and that will be helpful to you. So make a health plan. Where are you now? Where do you want to be? Now let me share a personal story with you. So after I had my 3rd baby, I've always been on the small side, okay? So before pregnancy, my weight was about 54, yeah? Now after baby, my weight was 79. So that's like more than 20 kg I have gained. Now some of you might be thinking 79, I can cope with that. It's not too bad. For me, that was a lot of excess baggage I did not need, because I could feel it. I could feel it when I was going up and down the stairs. I could feel it when I was carrying my baby. I could feel it when I had to go and do the school run. I could feel it when my thighs were rubbing together. That was the last straw. I was like, no way. I could feel it when my breathing changed. I felt more breathless. I just felt very unfit. Now, you know what? I could have said, why not, let me manage this weight, because a lot of people were actually telling me, oh, Olivia, you are looking very nice. Look at you. You're all filled up. You're looking very nice. And I could have been deceived by that. But see, they didn't know what I knew. I was going through, I was seeing the effect that it was having on my body. And thankfully, I also had the knowledge. And I was like, this weight is definitely not for me. I could have felt comfortable. I could have gone and bought size 14 clothing, ready for my new size. But I was not having none of it. I said to myself, this is not my weight. So I am going to do something about it. I refused to buy big size clothing. I just limited myself to the small that I had because I was pregnant. And I set myself a target. of how I was going to lose the weight. And I have done it. Now, my target is to reach my ideal weight, which I will, because I have a plan in place. So what is your plan? What is your aim? You don't want to lose weight because Jennifer Lopez is losing weight. You don't want to be size 8 because the Kardashians are size 8. What is your health goal? I've told you the risk factors that you can have, the complications, the serious things that can happen to you, to your life, if you are overweight. That should be your motivation. Don't lose weight for someone else. Lose weight for yourself. So part of your health plan, you need to decide how much do I want to lose and be realistic. There's no point saying I'm going to lose 20 kg in 4 weeks. You know it's not going to happen. Set yourself realistic targets. I'm going to lose 2 kg in the next 3 weeks. You know, do something that you think based on your life that is actually going to be achievable for you. That would motivate you to then take steps, because every little weight that you lose actually makes a change. Now, once you have your health plan, part of your health plan should be a diet plan, because you are what you eat. Most of us, we put on weight because of what we are putting in our body. It's because of the increased calorie intake. That's why we're putting on weight. So part of it should include your diet plan. You need to review what you're eating. And I think a couple of weeks ago, I put something about, if you want to lose weight, think about the portion size. Think about the type of food you're eating. Think about the timing. And the next series, we're actually going to go into detail about obesity and diet. So I don't want to labor that today. But basically, review what you're eating. And do you need to make any changes? Do you need to cut anything out? The other thing that you should include in your plan is an exercise plan. Because there's evidence to suggest that actually you need both exercise and diet to achieve significant weight loss. It's not enough to just do diet alone. Because some of you, you've realized that actually, you know, some of you come to see me like patients, they come to see and say, oh, you know, doctor, you know, I'm barely eating anything. I've cut out, you know, the doctor said I shouldn't eat sugar. I've cut it out, I've cut out everything, and I'm still putting on weight. And the reason being, when you diet, you're only sort of losing your lean body mass. But when you exercise, the fat distribution changes. So there's more weight loss in terms of fat loss when you exercise than just dieting. That's why when you diet, sometimes you notice that, okay, I've lost some weight, but when I look at my waist area, or I look at my belly area, there's still a lot of fat going on there, and I'm thinking, why am I not shifting it? But exercise will do that for you. So it's a combination of those. So I am going to leave it here today. I hope that you've been able to gain something, that actually obesity is not just having a bit of fat on the body, but it actually can have serious risk factors for your health. But the good news is that you and I can actually do something about it. We can do something about it by the changes that we make. So thank you for joining me today. The next time we're on, we're going to be dealing with obesity and diet. So looking specifically at food, the types of food, what you should be aiming for. And then following on from that, we'll look at obesity and exercise in detail and the evidence supporting that. So thank you so much for joining me. Please share this video with other people so that they can benefit from it. And the aim is that you need to keep well, you need to stay well. So today, you've gained the knowledge. From tomorrow, start taking action. So you've been hearing from me again, Dr. Ariyo. Good night and have a good evening.